It was a bit like a war scene, essentially. Watching TV, seeing the show Inside Combat Rescue, where you see a lot of implemented explosive devices and loss of limb. It was eerily reminiscent of that, and people were missing lower extremities. There was, as you've heard reports, a lot of shrapnel. Again, not clear if that came from the bomb itself or from the container that the bomb was in or nearby debris. But most of the injuries were to the lower extremities, although shrapnel was present everywhere. A lot of people had hearing loss from the blast as well. We had many trauma bays, obviously completely filled with patients. There were two waves. The first wave was about 8 patients that were critically injured, and then those patients went off to the operating room, and then a second wave of patients then arrived to fill those beds. So very, very, very dramatic, traumatic scene yesterday. But I have to say the ER staff was very well organized. The trauma surgeons, orthopedic surgeons, were spectacular, and it really was a lesson, I have to say, in organization. Sometimes too many people is not helpful, and I think a lot of it centered around getting the staff organized to get the right doctor to the right patient at the right time.
And Dr. Gibson, can you talk about the child victims that you saw? How many children have been treated at your hospital? And also talk about the amputations. We know that there's been at least 10 performed so far.
Yes, we did not have any children at our hospital that I saw. I have to say the picture of Carlos really was cropped, and what you don't see on the picture in most of the media is the fact that the poor young man who he was assisting had no leg, and many of these patients presented already with an amputation. There was traumatic amputations, but I do want to emphasize the real heroes were on the scene, people like Carlos who ran towards the blast rather than from the blast. And when they arrived at our hospital, these patients were very well stabilized. People like Carlos and people in the medical tents had already put on tourniquets to stop a lot of the bleeding, and that may have saved many lives. People like Carlos and the people on the scene.
The AP, Dr. Gibson, quoted a state trooper saying a lot of people amputated, at least 25 to 30, have at least one leg missing or an ankle missing or 2 legs missing. Is that your sense? Is that number right?
Well, I think, it's hard to know what is going to happen because some of the people may still have a limb in place, but over time, that limb may not be saved or salvaged, and that number may climb over time. There were many deformities, and it's unclear to me how many of those limbs will be salvaged. My job was there as a cardiac person to assist with the blood flow, blood pressure, heart, getting access into the arteries. That was my role.
I know one of the big problems that that people who ran to the aid of others had are those well-known barriers that certainly protesters face all over the country, but they were so heavy dividing the spectators from the runners, and they were collapsing on the spectators who were injured. Can you talk about the planning, the pre-planning, the disaster scenarios that you have in Boston that may well have helped in this situation?
Yeah, I want to emphasize when the blast went off, you saw people pushed away by the blast, but then what was very dramatic was the wave of humanity that then rushed towards the blast. I think people put the best interest of those patients who've been injured around them first, and there was a tremendous effort to clear the area around the blast. so that then emergency medical personnel could make their way into the area. You saw people pulling away the barriers, so tremendous heroic efforts on the part of those people, again, putting the injured's well-being ahead of theirs. You know, at the hospitals, there were many stretchers outside the hospital. There was also a biohazard unit assembled to do kind of detoxification if that was necessary. You know, you never know if this is just what was now being said a black blast, which was a traditional gunpowder kind of blast, or was there any kind of contamination? And the hospital was prepared for that. The hospital was locked down both by police and by military personnel all around the hospital, so that people could not enter the hospital unless they were a patient who was injured or a caregiver with identifiable information. And then a command and control center was set up inside the emergency room, again, to triage things, to, again, get the right level of care to the right patient at the right time. One of the things I then worked with the social workers on was connecting the family members to patients. One of the issues that happened was my son called at 2:54 to let me know that that he was okay, and that was really for me a very, very strong emotion to let me know that we also need to let other family members know that patients are here, or let them identify as their family member okay.
Are you also looking for evidence in the hospital? I mean, for example, the kind of shrapnel, and looking for evidence of what the bombs were?
Yeah, you know, one of the issues was, you know, you see a lot of entrance wounds into the body, but what's underneath that is not always clear. You have to do x-rays and other things, probe the areas to find out, was it glass, was it metal? You know, so that was a big part of it as well at the time people presented to the emergency room.